o'clock, a local hospital group is trying to improve the health of people living in Greenville County, and it goes much deeper than talking about diet and exercise.
Fox Carolina's Carrie Veal joins us live with more.
A health assessment done by Secours St. Francis found that health isn't just about what we put in our bodies or how often we go to the gym. It's much more complex.
So this is Julian. This was on his 20th birthday.
Stephanie Jones says her children are her world.
And then this is Ryan is on the Bulldogs, Berea Bulldogs football team.
She is a single mom and always put their needs first.
It really got busy.
When her son Julian was diagnosed with a rare cancer, her main goal was to take care of him.
And unfortunately, my son passed away July 26th. So dealing with all of that and then trying to schedule a time to have brain surgery.
The brain surgery was for her. This whole time, she was putting her son's health before herself, and now it was catching up.
April 26, 2013 was my first diagnosis of stage 3 breast cancer. And then I went through 18 weeks of chemo, 33 days of radiation, left mastectomy, reconstruction, all my pills.
In the last decade, she has battled breast cancer, a heart attack, and been diagnosed with type 2 diabetes. As a single mom who had to raise and take care of her family on her own, she didn't always have the resources to take care of herself.
I did get behind because at one point, let's say, I was out of work from July to November.
Pastor Sean Dogan says this is a perfect example of how environmental factors can play a big role in the health of an individual. He is the director of community health for Secours.
So when we look at health access and then we look at the social determinants of health, it's not in isolation. It is really in combination.
Secours St. Francis recently completed their 2022 health assessment. It found the biggest health priorities are mental health, access to care, and homelessness.
If you don't have transportation, or if you don't have the finances to purchase prescriptions, if you're not living in a place that you feel is safe, all of those things bring more complications to your health, period.
He says they have a few ways they plan to tackle these issues.
Utilizing our partners in community. So whether that is helping people with transportation vouchers or bus tickets, or whether that is helping those who are in food deserts with access to fresh fruits and vegetables.
Dogan says they are also helping people get access to free or low-costing medical care. Jones says someone helped her sign up for Medicaid, and it was a true lifesaver.
Honestly, I thought you have to be unemployed and like 65 years old and older. I'm 49, so I'm thinking that I wouldn't qualify, but I did.
Instead of worrying about finances, she can now focus on her health and taking care of herself.
But I didn't even know to even ask those questions. So I would say if anyone is ever hospitalized or feel like their medical bills are too high, find out from Medicaid or Medicare what you can actually benefit from. Maybe it'll reduce the bill.
Yeah, and Secours is partnering with several local organizations to help meet the health needs identified in that study. We will have more on how you can seek help on our website at foxcarolina.com. Carrie Veal, Fox Carolina News.